Welcome to the Kaleidoscope of Possibilities, Alternative Perspectives on Mental Health. My name is Dr. Adriana Popescu. I'm a licensed clinical psychologist and leader in the field of mental health, energy psychology, addiction, trauma, and empowerment. In this podcast, we will be exploring mental health from a variety of perspectives, from the spiritual to the shamanic and beyond. What if mental illness isn't everything we think it is? What if everything we see as a pathology is actually a possibility? What else is possible with mental health? Hi, everyone. Dr. Adriana Popescu here with you today with another episode of Kaleidoscope of Possibilities, Alternative Perspectives on Mental Health. I'm really excited to have with me today Dr. Angela Cates. She is a doctor of pharmacy, a board-certified pharmacotherapy specialist, and a certified functional medicine practitioner. Angela founded Cultivate Health and Wellness with a focus on the gut-brain connection and created her signature program, Beyond ADHD, after helping her own son with ADHD and anxiety. Beyond ADHD is a functional medicine approach to support parents of children with ADHD, anxiety, and depression. Her goal is to help parents identify the root causes of ADHD, anxiety, and depression and minimize medication use so her clients' children can thrive. Welcome, Angela. Thanks so much for being with us here today.
Thank you so much for having me. I'm happy to be here.
Yeah. I love exploring these alternative perspectives on what we have considered traditional mental health, as if mental is separate from physical and emotional and spiritual and all the rest. But I always like to start off the show with asking our guests a little bit about themselves and how they came to do the work that they're doing. So would you mind sharing with us a little bit about yourself?
Yeah, of course. So first of all, I'm a wife. I'm a mother to 2 kids. My son will be 14 next week. My daughter just turned 12. So we're right in the middle of that preteen teen stage. We live on a farm in Indiana. So lots of time outdoors and country time. And I am a pharmacist by training. So I went to Purdue University quite a while ago. I've had over 15 years experience as a pharmacist. And so you may be wondering how I ended up here, kind of in this alternative space. And that's kind of some of the story we're going to share. But basically, my son, when he started middle school, was having a lot of issues with ADHD and anxiety. And so being a pharmacist, we went the medication route. We tried that. Even working with a great psychiatrist, multiple medication trials and changing medications. And we just were not getting the improvement we hoped. We were having lots of side effects. He was still struggling. And I just kept asking myself, why? Like, why is he having all these issues? I mean, as far as we knew, fortunately for him, trauma wasn't an issue. So just really trying to uncover why this was going on. And at the same time, kind of in my pharmacy space, I had learned about some other pharmacists doing functional medicine. And so I just really started to explore. I started to do CEs. I started to do training. I took my son to a functional medicine practitioner, and my eyes were just really opened to a whole new world. And so that really is what got me going on this journey of uncovering and, just throwing myself into figuring out how I could help him.
Mm-hmm. Yeah, often it is the personal journey, right? We don't necessarily intend to pursue these things, but life shows up in a way that kind of changes our course. Yeah, I totally relate to that. So tell us a little bit about what exactly is functional medicine.
Yeah. Well, to put simply, functional medicine is basically identifying the root cause of symptoms. So instead of traditional or conventional medicine, where you might say, they might diagnose you, here's your problem, and here's a medication to treat the symptoms. Functional medicine says why. Why are you having these symptoms? What's going on underneath to cause you to have these issues that you have? So it's really about digging in. And a lot of times, the root cause could have something to do with your gut health. It could have something to do with nutrient deficiencies, be what you're eating, or stress, or lack of sleep. So often the root causes are some of our basic lifestyle things we need to be doing, but sometimes there's more to it. And so really, as functional medicine, a good provider should do a really in-depth history, even back to birth. What's gone on? What things have you been exposed to? What stressors, what social situations are going on? Because all these things together kind of create that picture of what's going on with the person. And so really involving the person in the process as well, the client, getting their perspective for what's going on and what's important to them as well.
Right. And then do you do any kind of testing as part of that, like testing people's blood or different body fluids or things like that?
Yes. And so this is sometimes where I think functional medicine sometimes gets a bad rap, or it can be difficult for some people, because part of uncovering root causes is through some of these functional lab tests. And some of them are not covered by insurance typically. So a lot of times there is some out-of-pocket expense to it. But yes, the test that I really I like doing an organic acid test. And that tells us a lot about, is there an overgrowth of bacteria? Could there be an underlying candida infection? Are there nutrient deficiencies? And those are all things that once we identify, here's the issue, then we can take steps to work on addressing it. Also do hair tests, like take a hair sample and it can tell you if they have had exposure to heavy metals. Heavy metal exposure like lead can cause a lot of ADHD symptoms. So you want to check and see if that's an issue. Also copper and zinc and magnesium, like all those minerals we can look at on a hair test. And we hear a lot about zinc, especially for immune health. But there's this delicate zinc copper balance. And if that gets out of balance, that can contribute to symptoms of ADHD and anxiety. So I like to check and see what's our status there. Same with the magnesium. That's one of the most common deficiencies, in the US in our diets. We're not getting it through our diets. Lots of people are low in magnesium, which causes a whole host of issues. Mm-hmm. It can cause difficulty with focus, can cause difficulty with sleep, can cause constipation, which kind of goes back to that gut health issue. That's taking care of your gut health. That's how your body removes toxins. And so just even something that seems minor, like a magnesium deficiency, can have a whole host of trickle down effects.
Right. And it didn't, some people might wonder, well, why lately? It seems like when I was a kid, we didn't have ADD, ADHD, and the kids weren't getting diagnosed with that. It probably was going on, but it certainly didn't seem as big of a thing as it is now. What do you attribute that to?
Yeah, I think a couple of things. I do think they have gotten better at diagnosing it is one issue, especially in girls, which I think are still lagging behind as far as the diagnosis, because in girls, ADHD typically presents differently. They might have more of that inattentive type. They may not be causing problems in the classroom or disrupting, and so it might get overlooked if the teachers aren't and the parents aren't really looking for it. So, I think we've gotten better at diagnosing it. But otherwise, there's so many other factors going on. We're having so many more additives in our food and preservatives, the artificial dyes. The amount of sugar in our food compared to what it used to be is just astronomical. That definitely plays a role. We live in such a toxic world. We're exposed to so many more toxins than we used to be. Cleaning products, laundry products, personal care, our skin is just a big mouth. And so anything we're putting on our skin, our body's absorbing it. So that's playing a role as well. And then antibiotic use, you might wonder how that's related, but excessive antibiotic use can get rid of the good bacteria in your gut and allow some of these harmful ones to overgrow. And there's a certain type made by the Clostridia species. They produce this toxic byproduct, this bacteria does, that causes ADHD symptoms. So I think that plays a role as well. So, and most of my clients, most of my kids that I've worked with, it's not just one issue, oh, you had a nutrient deficiency and here was the issue. a lot of times it's like, okay, we had this genetic predisposition. We are low in this nutrient. You were on a lot of antibiotics as a kid, so you have bad gut bacteria. Maybe you're exposed to toxic products. So a lot of times it's not just one thing. It's this whole host of issues, which I'm sure you've kind of seen as well. Mm-hmm. And then it's really my job working with the parents, like uncovering, pulling back these layers. Let's fix this, then let's work on this and work on this to get them to the point that they're thriving and doing well.
Yeah. And I think too, what underlies all of that is this idea that the body is a whole system and that you can't really separate, like nothing is really separate. And I think our Western medical model is very fragmented, right? Like you go to this doctor, if you have a throat thing, you go to the ENT. If you have a stomach thing, you go to the stomach doctor. If you have a foot thing, you go to the foot doctor. Rather than like, it seems like in traditional medicine, they're not looking at the whole person and how all the systems work together. Like I know for myself, when I had Lyme disease, I had a lot of the things earlier in life that you were talking about. And yes, I was bitten by a tick that had this, but like what it did, like this would get out of whack. My hormones would get out of whack, which then made my neurotransmitters go out of whack. And because I had gut dysbiosis, everything just went sideways, but it was all connected. You couldn't just treat one symptom and expect that was going to make things better. And I learned that the hard way.
Mm-hmm. Right. Or the fact that, the symptom, the medication might treat the symptom, you might feel a little bit better, but is it causing another downstream effect? Yeah. It's either depleting your body of a different nutrient, so you need to make sure you're adding that back in, or, our bodies are smart. If you're causing it to, do something different, it can upregulate a receptor or downregulate a receptor. It can find a way to work around that. And that's where I really kind of pull in my knowledge as a pharmacist. Like, sometimes medications are very useful and helpful, but let's make sure we've addressed the other issues first. And then let's make sure if you are taking a medication that we're supporting you as best we can so that you're not going to get the side effects or so that you're not going to get these downstream effects. So, really kind of pulling that into the picture as well.
Well, and yeah, I want to explore that a little bit more, because you have this unique, background as a pharmacist. A lot of people who don't really understand or know about even all this stuff, which is why we're having this conversation. A lot of times how this comes to be for parents is they're getting reports from school that their kid is acting up, can't sit still, can't pay attention. And the school thinks the parent should take the kid to the doctor and basically put them on some sort of stimulant medication, because stimulant medication has been shown to have this paradoxical effect that it actually calms kids with ADHD down. But I don't think very often people are looking at what you said, like what's the systemic effect of taking these medications. And I, as an addiction specialist, end up seeing people as adults who often have developed an addiction to methamphetamine or, to their amphetamine where they're using them beyond what's prescribed. And I wonder what early exposure to these medications is doing to kids' brains over time.
Yes. Ooh, that is a great question. And, I think there's a couple of things, because I hear evidence on both sides, about stimulant use being linked to substance abuse later in life. And so I think there's a couple of factors. One, I'm sure you've seen this, the ADHD brain is kind of more wired towards that type of propensity anyways. And so, that's one factor. And then because you can misuse the stimulants, you can get a euphoric effect, you can use them for performance enhancing effects. So if you are misusing them, that is a form of substance abuse. But we also kind of see on the flip side, if you are not treating ADHD, which that treatment doesn't necessarily mean treatment with a medication, but untreated ADHD, people will find a way to self-medicate. And so they might gravitate towards some of those substances to self-medicate if they're not prescribed. So I think it's a very delicate and difficult balance. I think especially as parents, making sure, especially once they get into those adolescent teen years, that they're not misusing them, that they're not sharing them with their friends, that they're taking them as intended. Because in general, they find that if people are taking them as intended, it shouldn't lead to substance abuse. Now, you may know better working more specifically in that field, but I know that's definitely a concern, which is another reason to try to address these other factors first, and maybe you won't need the medication.
Right. Well, and it really kind of even throws the whole diagnosis in question, right? Because I also have worked with folks who got this diagnosis early on, maybe in their school years, and that what that did to their self-esteem, right? Like, oh, okay, I have a disease. There's something wrong with me. I remember working with a woman who really thought she was stupid, because she had this diagnosis and she carried this like core belief about herself that I'm stupid, which as an adult ended up really impacting her in a lot of negative ways. Like she wouldn't go for jobs that she was qualified for because she didn't believe she could be successful. And we had to really undo a lot of this. And I'm sitting here thinking, well, gosh, did she really even have that? Or did she just have gut imbalance? Did she have an allergic reaction to red dye number 9 or whatever it is, right? Like,
yes.
Is this even really, is it being overdiagnosed and the symptoms of some other imbalance being misidentified as ADD, ADHD when it isn't that?
Yes. And I think that's very likely in a lot of cases, because like you said, the thing that makes it difficult with mental health, there's not like a lab test. You just do this lab test, or not like, okay, we measure your blood pressure, you have high blood pressure. That's not how it works in mental health. It's, what are your symptoms? And we kind of group them together and give them a diagnosis. So you're right, it can be easy to misdiagnose, especially if the symptoms look similar. And so that's where it really makes sense to address some of these other issues and make sure, if we can correct it, we may not need the medication. Because we had a very similar thing with my son. He was in second grade, was, having trouble reading at school, and they do the assessments. And, we went to counseling to work on some parent coaching skills. And unfortunately, this therapist was like, well, really, your only option is to put him on medication, or, he's going to flunk out of school. He's going to have accidents when he's driving, just really, putting the guilt trip on. And, I wish I knew then what I know now. There are so many other avenues you could take, things that can be tried first. But I think there's still a lot of that out there. It's like, okay, here's what you look like at school. Looks like ADHD. We're just going to put you on a stimulant. And that's what parents are left with. And it's difficult to navigate, especially, both of us are kind of in this field and we know, but even for me, it's hard to make those decisions sometimes. And there's so much information for and against medication and whether you treat it or don't treat it. And so that's where I really try to come along parents. I'm like, what have we tried so far? What else can we try? Are there other things we can address? Do we need to look at nutrient deficiencies? Like you said, the gut imbalance is a big one as well.
Yeah. But tell us more about that, because I think more and more people are hearing about gut dysbiosis and what all that means, but I still think a lot of people don't quite get it. So what exactly is a healthy gut, unhealthy gut, and how does that impact mental health?
Yeah, I know it was like, well, really? How could that be? But so there's a thing called the gut-brain connection, but there's really several ways the gut and the brain are connected. So one, we have the vagus nerve that runs from your brain to your gut. And so those nerve impulses are sending signals. Actually, your gut is sending more signals up to your brain than your brain is to your gut, but they're communicating both ways. So that's one way that they're connected. And you'll see there's some treatments coming out that are actually vagus nerve stimulators, trying to like strengthen the vagus nerve. You can do things like gargling or singing that can help strengthen your vagus nerve and improve that connection. Also, those bacteria, the good bacteria that live in your gut, they're making vitamins that are needed for neurotransmitters like serotonin and dopamine. And they're also making those neurotransmitters like serotonin and dopamine. Those are actually made in your gut. So that's another way that they're kind of connected, because those affect kind of the signaling in your brain and how your brain is communicating. And then we also have the immune system, the gut immune connection. And so this is where kind of leaky gut comes in, if people have heard of leaky gut. So basically the barrier or the lining of your gut should have these tight little openings that only allow like nutrients from digested food to get through and get where they need to be. But if you have a lot of inflammation, which could be caused by antibiotics or toxins or processed foods, artificial sweeteners, gluten. If you have a lot of these things causing inflammation in your stomach, those kind of openings, they can get really wide, and they allow the bacteria, the toxins, the undigested food to go straight from your gut into your bloodstream. Then they travel throughout your body. It can cause joint pain. If it travels to your brain, that's what's causing that brain fog after you eat. You eat something, and then you're like just exhausted. So that's another way. And those things that they can cause inflammation in your brain. And our brain, the way that we know it's inflamed isn't by necessarily hurting, like like maybe your joints or something else would hurt if they're inflamed. You feel anxious, you feel depressed, you can't focus, you have brain fog. So that's how your brain is telling you, hey, it's inflamed in here, something isn't right.
I wanted to ask. Yeah, sorry. But inflammation is actually something I had wanted to ask you about, because more and more I'm reading about and hearing, and we've talked even in the podcast or on some earlier episodes about this inflammation or like mast cell activation syndrome really seeming to be a root cause for a lot of different conditions.
Yes. And I think it's very interesting that even looking on the conventional medicine side, so new treatments that they're working on for depression have to do with inflammation. Mm-hmm. So I think inflammation, they're realizing, is a much bigger piece than what has happened in the past. And yeah, I think so many of our health conditions are tracked back to inflammation, which gut health. So I didn't really, I guess I didn't get to the point of what is good gut health, but it would be not having that inflammation, having a good balance of those beneficial, those helpful bacteria that make the good things, not having too many of the bad bacteria. And the way that you would know that is through a test. Either I use the GI map, which is a stool test, and that gives you a lot of the intestinal markers and the good and bad bacteria. Organic acid test can also show you overgrowth of bacteria, or if you have the yeast like candida growth. But then also just in general, for you to kind of check in with yourself, like, are you having routine bowel movements, like 1 to 3 times a day? Are you, that's what you want to aim for. If you're getting bloated and constipated and having a lot of GI pain and issues, especially after you eat, those are some signs that probably something's going on. It's either what you're eating or, an overgrowth, something out of balance. So those are some things you can even check in yourself.
Yeah. So when you discover that people have these kinds of imbalances, you mentioned doing corrections. What are some of the corrections that you use in your practice?
Okay. That's a great question. So, depending on what the issue is, sometimes we'll remove certain foods from the diet. Gluten and dairy are two that a lot of times we end up removing, and sometimes just temporarily. Adding fiber into the diet is one that we often do, especially if there's not enough good bacteria. Adding some prebiotic fiber, that's kind of the food for the good bacteria. Sometimes we'll use digestive enzymes or probiotics. And if there is an overgrowth, we can use herbs that have antimicrobial effects. So they kind of help kill off some of that bad bacteria. And in some cases, in functional medicine practice, they will use prescription antibiotics or antifungal treatments if there is a significant overgrowth, just to kind of get that down. So those are some of the treatments that we would use.
Mm-hmm. Do you think at this point, because I'm somebody who, has recovered from Lyme disease and chronic fatigue syndrome, and many of the things you talk about were true for me, especially the systemic yeast infections, and like not just in, certain body parts, but just throughout my whole system. And it was really hard actually to clear that, particularly because I also had heavy metal toxicity, and all the things go together. But I still take, I went from taking maybe 50 or 60 supplements a day to I still take about 20 or so just as part of my maintenance. Because I think the world that our soil is so depleted, even though I eat pretty healthy, I don't know how many vitamins and minerals are in my food these days. Especially here in California where I live, we're pretty over-farmed. Our land is really over-farmed. And toxins, you drive down the freeway and then there's the food fields right there. And I'm thinking, gosh, there's like big trucks driving by, like what's getting in the food from the smog and everything. So do you think most of us at this point probably need some sort of supplementation just to maintain health in general?
Oh, that's a great question. That's highly debated. I mean, in an ideal world, we would get everything we need from our food. But I think, like you've said, that's very difficult. And especially if you are someone who has struggled with chronic health conditions, I mean, you may have some underlying genetic tendency to be low in certain nutrients or to have difficulty detoxing certain things. So I find that most people I work with, we do a period where it's more intense supplementation to kind of get things in balance. And then we do maintenance. I'm like you, I take a handful of supplements in the morning and at night. Just because, partially it is kind of hard it can be difficult to get to that point where you're feeling better. And like you said, with the candida, that's difficult to get rid of. You want to make sure you maintain and don't go back there. So I don't think it's, I'm not surprised that lots of us do take routine supplements because it is difficult, to get everything you need from your food.
Well, that, and then the other piece I wanted to look at is stress. Like we know from way back when that stress has a really negative impact on all of our body's functions. And we're living in a very, very stressful time, especially the last few years with this pandemic. And kids in particular are really feeling the effects of the stress, having had at-home schooling and just everything that's unfolded, especially recently. Can you talk a little bit about the role that stress plays with all of this?
Yeah. So it's kind of interesting. Stress and gut health, especially, they have this connection. If you are under a lot of stress, it's going to upregulate the harmful bacteria in your gut. And then those harmful bacteria are going to cause more stress. So it just kind of gets in this cycle. And then, of course, I think we all know how the stress affects our mental health. And so I do think that, supporting our stress, supplements is one way to do it, just because when you're under that much stress, you're depleting a lot of those nutrients that your body needs, and it can be really hard to keep up and maintain those. So I think that's reasonable, as well as, practicing our stress relieving techniques as much as we can. But like you said, it's difficult in this busy world, and our brains are just constantly, having all these thoughts and all these things triggering that stress response. So we have to be really intentional.
Yeah, which kind of brings me to what you've talked about, and maybe you can go into a little more depth with this overlap between different mental health diagnoses. Like I, even from the time I was an intern as a psychologist, remember working with kids and seeing this big overlap between anxiety and ADHD, or depression and ADHD, but particularly anxiety. So I'm curious, from your perspective, what do you attribute that to? What's happening there?
Well, it's kind of there's several things involved with it. And that's really where my son struggled a lot. We had that he'd always been a little bit kind of anxious or my worrier, but first he was diagnosed with ADHD and we worked on treating that. But then unfortunately, a lot of the stimulants make anxiety worse. And so you get that worsening anxiety, but at the same time, not being able to focus at school or not being able to understand what's going on due to the ADHD and kind of having your brain wired differently, that causes a lot of anxiety as well.
Right.
And so from what I've read and from what I understand, I mean, it's a lot of the brain wiring and just the way that your ADHD brain thinks differently causes a lot of anxiety. I know for kids, for my son, just realizing that he was different and that he thought differently. You brought this up earlier, but the self-confidence, the self-esteem, that makes it so difficult. And, trying to explain your brain isn't bad. It's just different. And, you need to do things a little bit differently than some other people. But I think that causes a lot of anxiety and just the constantly trying to fit into, maybe the school setting that isn't designed very well sometimes for kids with ADHD.
Or any kid.
Yes, but specifically. So, I do think that's a piece, but adults as well. A lot of adults, there's a big overlap with the ADHD and anxiety. And I think, just your brain constantly having to work harder to pay attention and keep things organized and in line, it causes a lot of anxiety. And it does make it difficult to diagnose because a lot of the symptoms are very similar. A child in class, are they, inattentive ADHD, or are they just so anxious that they're just sitting there and not able to comprehend what's going on?
It's very complex. And then if you put trauma in the mix, right, we know that these adverse childhood experiences, which can be, people think trauma, well, like physical, emotional, sexual abuse, yes. But also if you grow up in a home where there's a lot of chaos, there's fighting, there's maybe somebody has an addiction issue or a mental health issue, like that can be also change the way a child's brain develops, right? And can affect that wiring in the brain.
Yes, absolutely. So, that plays a role. And then you mentioned a little bit too, there's a big overlap with depression and ADHD and then learning disabilities as well.
Yes.
And so all those things, I just learned not too long ago, I didn't even know there was a term for it, but complex ADHD, which would be ADHD with at least one other diagnosis.
Yes.
And I think that's more of what we're seeing.
Well, and now with the brain scans, I'm thinking of Dr. Daniel Amen, right?
Yes.
And his work with the SPECT scans. I think he's come up with 7 different types of ADHD because they really the symptoms can show up really differently, like you said, between boys and girls, and different permutations between a more inattentive type versus a more hyper type. So they're really, but even to now be able to see how the brains are so different, even across this one diagnosis, is pretty fascinating.
Yes. And I think that's so exciting. And I think that's really going to help guide our treatment because really knowing, because there is so many different, people will stereotype, oh, like that's an ADHD thing. But I've seen so many different presentations of how ADHD presents. And, one example, I think a lot of people think of them as being unorganized. But a lot of people with ADHD, their brain, they want it very organized. Less physical clutter means less mental clutter. And so, I think sometimes that gets overlooked if you are a type that's much more like you want everything neat and orderly so that you can, kind of think.
And honestly, as somebody who I would say probably fits some of these characteristics myself, I don't see it as a pathology either. I see it as like, I'm somebody whose brain works so fast that having 50 windows open on my computer, 50 tabs on like 5 different windows, which really is how it is for me, actually like works better because I don't have the patience to sit and wait for a page to load, or I'm working. I feel like I have an 8-track mind, like I can work on 8 different things at once. And I don't see that as a problem, like I'm not getting lost in that. I know exactly, how to get back to whatever I was working on before. So even questioning, like, is this a pathology versus is this just neurodivergence, right? Is this just that my brain works differently than somebody else's brain and neither one is better or worse than the other?
Yeah. And I think you're right on with that. And a coach that we worked with initially when my son was diagnosed, I loved how she explained it. She was like, your brain has a superpower because you can hyper focus on things that interest you and be very successful. And I think this is where it comes in. A lot of people are like, oh, well, do you outgrow ADHD as an adult? And I'm not sure your opinion, but my thoughts on this are the people who appear to outgrow it are the people that have really figured out what type of life or work situation that they can really excel at by the way that their brain works. And sure, if you're in a job that doesn't interest you or doesn't play well to your strengths and the way your brain is wired, you probably will continue to struggle. But, a lot of people are able to really become very passionate about something and just hyper focus on that. And they're very successful.
For sure. And also I think to address the learning styles, like what I've realized is I'm not a person who can sit in a passive lecture and just sit there and like not have anything else to do with my hands or like focus my attention on. So I'm that person who might be in a workshop on my phone, totally present and listening, but I can't, it's almost too slow for me to just sit there and stare at the person talking. And if I can't engage, if there's no sort of activity for me to engage in, I'm going to get bored. So I wonder how much of it as well comes back to how we're teaching kids and the model we use. And is the model that we're using from like the 1800s where kids just like sit there silently for hours at a time? Like, is that really designed to match their learning styles? Or I've seen now they have like bouncy things for kids to sit on. Improvements are slowly happening, but I also have to wonder about our educational system and if it's really meeting the needs of our kids rather than pathologizing the kids who are not fitting into the box of the education system.
Yes, 100% agree with that. And it took me a while to accept, my son, we did public school and private school and homeschool, and now he's doing online. And we finally found a situation that works because, it was like we were trying to fit him into a box that he did not fit in. And it's been very interesting. And then my daughter does not have an ADHD diagnosis, although I think she likely has it, but she has been able to, she chews gum during class. She's doodling on her paper. She's listening. She's doing really well in school. We've had a few teachers that don't like her doodling. And I'm like, well, this is how she's paying attention. She's learning. This is how she's coping. I mean, as long as she's not disrupting other people, I don't see what the problem is. But I think you're right with the educational system needing to continue to evolve. And especially, unfortunately, now with smartphones and TVs, and we are in an instant gratification, generation. And so they're used to things moving like that. And so then to sit in a classroom and not get that constant stimulation, it's a challenge.
Yes. Yeah. I wonder what that bodes for us as an evolution of a species with that constant barrage of do. I wonder what that's actually creating, but that might be a conversation for another time. So this has been super fascinating. Angela, if people want to find out more about you and your programs, where can they go?
Okay. Yeah. My website is beyondadhdrx.com. I am hosting a webinar tomorrow, which I think will be last week by the time this podcast airs, but I will have replays available. I do work one-on-one with parents who want to do some of this testing to find out root causes for their children. And then I'm working on putting together a course that parents could work through on their own, kind of explaining some of these things and some of the other supports they can do. So hopefully that'll be out in the next couple months. You can also find me on Instagram at Dr. Angela Cates. And I have a Facebook group as well called Beyond ADHD.
Wonderful. I'm so grateful that you're out there doing this work. It's so needed. Any final thoughts for us before we go?
I think, overall, just make sure you're being your child's advocate. I mean, with the school, even with your physician, with other parents, you are the one that knows your child best. So listen to yourself and really advocate for your child. And if something feels like it's not making sense or it's making them worse, question it and just keep going. It took us several years to get to the place where we feel like things are finally going well. So yeah, just continue to work with your child and be their advocate, as I'm sure you are. So, well, thank you so much for having me on. This has been a great conversation, and I'm glad for your work in this space as well, because yeah, much needed. And the more that we can educate and get this message out to people, the more people we can help.
Right on. Yes. Thank you so much, Angela. Thank you, everyone who tuned in today. If you like this podcast, if you found it important, valuable information, please do share it, subscribe, comment, rate it, all the things, because the more people do those things, the more the algorithms will get this out into the world. And that's really what we're wanting, is to educate people and to create change. So thanks so much for tuning in, and see you next time on Kaleidoscope of Possibilities.
Thank you for joining me for this episode of Kaleidoscope of Possibilities, Alternative Perspectives on Mental Health. This has been Dr. Adriana Popescu. If you enjoyed this episode, please like and subscribe and share with others. To find out more about me, my guests, and more, please visit my website at adrianapopescu.org. See you next time.